Hi NurseX, thank you for meeting with me today to review your annual performance appraisal. This time is a great opportunity to visit about areas of your performance, and it's also a chance for me to receive feedback from you. I utilize the same evaluation form for all employees, and this form allows me to rate areas on a scale. I will review some of your strengths that I have witnessed along with some feedback on a couple items that I observed. At any point during our conversation that you have something you'd like to add, please feel free to do so. First, I just want to say that I have been observing some of your tasks in the last couple of weeks, and I overall am very pleased with your performance. I believe that one of your strengths was witnessed in communication. One positive observation was in a nurse handoff. You were very detailed, sharing the necessary information with the oncoming nurse. In communication with a doctor, you utilize the SBAR tool to explain a situation with a patient, advocating for a positive patient outcome, remaining professional during the call. I noted your communication with patients, colleagues, and doctors were personable in nature, exhibiting relationship building, which is one of our organization's quality focus areas. So great job. Another strength of yours is your customer focus. Your actions are in line with this organization's mission and commitment to customers. It seems that you are invested in the patient's goals, providing them autonomy while also assisting them to meet their goals. I was very pleased with that observation. One item that I wanted to visit with you about is related to infection control. There was a time that I didn't see utilization of hand washing when entering and exiting a patient room. Hand washing is the #1 effective intervention in preventing the spread of germs, so that is a quality focus area that we have at this organization. Remember, gloves don't take away the necessity of hand washing. Along with this concept, there was a time during a dressing change that the garbage was pushed down with the bottom of a shoe. And I thought about this for a while, and I believe that the best practice would be to utilize your glove if needed, and then don the glove and wash your hands while eradicating the germs with the process of hand washing. So clean versus dirty, comes into play here, back with those CNA guidelines. The other item of interest would be regarding the EMAR. There was one time when you helped a patient to the restroom, which was good, but the EMAR was left open at the patient's bedside. Although there was no one in the room at this time, it's possible you could have been tied up in the restroom, allowing time for someone to come in and observe the patient's private information. So the HIPAA rule is one of those top priorities here, and it's just to protect the patient's privacy and information. All right, do you have anything to add regarding these items so far? Okay, so both infection control and HIPAA are topics that are upcoming Learning Center items that will be covered for this month's continuing education. I think that these two topics will be good review for you, and if you have any questions that you would like to visit about or talk about, please feel free to visit with me about them. All right, I believe that concludes our performance appraisal and talking points that I had to cover today. I sure thank you for your time today, and I'm just wondering if you have any feedback at all for me at this point. Okay, if not, I'm very glad you chose this organization as your workplace. Please contact me anytime if you have a concern or just have something to share. Thank you.